We are Garrett and Corynn. We are the two PAs here at Aesthetic Solutions. So just a little overview of what we're doing today. We're going to chat through some of the more common vascular concerns that we treat here in the office with our Vbeam, which is the pulse dye laser we're talking about today. And then we're going to have a little bit of time at the end for everybody to submit some questions. So just a few common vascular concerns we'll be touching on: rosacea, some scars that are red, including surgical and acne scars. We'll be talking about poikiloderma, which is a sun damage redness. We'll also be talking about cherry angiomas and briefly touching on some birthmarks.
The rosacea. So this is extremely common. Genetics plays a huge role. So this is something that we cannot cure, but we can greatly improve and manage. Treatment of rosacea is going to be complex. We're usually discussing skincare, making some modifications if needed, possibly considering medications, whether that's topical or oral. But one of our best tools for rosacea treatment is going to be our Vbeam laser. Patients come in, they're complaining of redness, mainly across the mid-face, but it can be more diffuse. But they're persistently red. They might have times of increased redness and flushing. Common triggers include exercise, stress, alcohol, spicy foods. Often we'll see visible blood vessels scatter on the face, and sometimes we'll also see breakouts, small little papules and pustules that resemble acne and often misdiagnosed as acne.
So we do treat a lot of scars in this office. What we're focusing on today are scars that have redness. There are a lot of other modalities that we use to treat the textural portion of scars, so the atrophy or roughness or bumpiness of scars. Today, we're mostly focused on the red discoloration that can sometimes happen. So what happens when you get a little injury, whether it's from a shave biopsy or a breakout or a traumatic injury, your body sends new blood vessels to that area to help heal and send nutrients to the injured tissue. What happens, unfortunately, is after that tissue heals, blood vessels can remain even after the healing process and create that red discoloration. So particularly for acne scars, it can make, kind of like what you see with this top picture here, it can make the scars look a little deeper than they actually are. And for surgical scars, can make them much more apparent than they would be if they were flesh colored.
Cherry angioma is also very common. I think if we all peeked at our body, more than half of us would find at least one, if not more. These lesions are completely benign, but they do persist once they develop. They often enlarge, which can make them commonly irritated, possibly bleed. Treatment with the laser is very effective, so it's a great thing that we can address. These are very genetic. Unfortunately, people do find with age that they develop more. And sometimes we'll see with pregnancy and big hormonal shifts, we might see kind of an increase in the numbers.
So birthmarks, we do see quite a few of these. We do treat children in this office, but a large majority of the patients we see are adults who have lived with their birthmarks for many years. Most commonly, the most common birthmarks we see are the port wine stains. Usually these first appear as flat reddish pink spots in infancy. These do tend to darken with age, and sometimes in adulthood will even take on a thickened, raised, kind of bumpy appearance like you see in that top left photo. These typically do not fade on their own. They do require treatment, and the vascular laser is very effective. You'll see some before and after photos in later slides. Hemangiomas, so the top right photo, these are sometimes called strawberry birthmarks. They usually appear in the first few weeks to months of life. They look like raised red bumps, maybe a little similar to a cherry angioma, just bigger. These can shrink over time, and if they do, they may not require treatment. If they don't, again, the vascular laser is usually very effective. Nevus simplex, so this bottom photo here, these are sometimes called stork bites or salmon patches. These usually appear on the nape of the neck, eyelids, forehead. These often do fade with age, but sometimes do linger. They're usually lighter in color, almost a peachy light discoloration. But again, if they do persist, we can treat them successfully with Vbeam. Poikiloderma. So this is another very common complaint. It very often presents on sun-exposed areas in fair-skinned adults with extensive histories of sun exposure. So this is caused by multiple sunburns, many years of sun exposure, very common on the neck, and it usually has this very classic reddish-brown kind of reticulated pattern, almost a little speckly in appearance. These patients usually do require more treatments with the vascular laser, and certainly when you come in for consult, we would tell you what to expect and how many treatments. Usually, though, it is a little more stubborn than some of our other complaints that we treat, and the downtime is usually a little bit more significant for these patients.
So Vbeam, this is going to be our gold standard laser for vascular concerns. It's a pulse dye laser, and it utilizes the wavelength 595 nanometers to target the oxygenated hemoglobin. So it's attracted to the blood in the vessels. With this, we're able to coagulate and irritate those veins and damage them. So as the body comes in to heal and repair, then removes those veins. These are not veins that we need to have for healthy, normal skin function. What we're addressing is that hypervascularity and that increased vascularity on the top surface of the skin. This laser, again, only attracted to vascularity, so we're not going to be addressing brown pigmentation, skin texture. Treatment does require a series, typically 4 to 6 sessions. For rosacea patients, scars as well. Poikiloderma, as Garrett did mention, can be more stubborn, can require additional treatments. Same with vascular birthmarks, especially when they're very dense, very thick. Again, additional treatments needed. We space these sessions 4 to 6 weeks apart. The nice thing is we do see progress and improvement as we're going through the series. So this does make patients very motivated and excited to continue. Maintenance also can be required. Rosacea, very genetic. Those red tones will try to creep back in with time. So we're typically planning on a session every 6 months to keep things like rosacea, poikiloderma, just those results that we achieved. Very safe, very approachable laser. Only contraindications would be if somebody was sunburn or an active infection in that treatment area.
All right, so we'll just kind of go through what the whole treatment, what to expect during, before, and after treatment. So when you come in for Vbeam, it's actually a really, really quick laser, particularly if we're treating the face. It's usually no more than 5 to 10 minutes. We don't use topical numbing with this laser. Unfortunately, it is a little bit zappy with each pulse, but the topical numbing has a vasoconstrictive effect, which means it shrinks those blood vessels that the laser needs to treat. So it makes the laser a little less effective when we apply topical numbing. However, most people do get through these treatments pretty well. It's usually a fairly well-tolerated treatment. Each little pulse feels kind of like getting popped with a hair tie or rubber band. It's a hot little quick snap, but it is over very, very quickly. Immediately after, your face looks very splotchy and sunburned, so you probably won't want to have plans immediately after your treatment, but it usually dissipates in the first few hours. And then Corynn's going to go over what to expect in the few days following the treatment. But again, that immediate sunburn, splotchy look in the areas that we've treated is usually self-limited and goes away within the first night. We do give you an ice pack when you leave the office because it does feel a little warm and stingy like a sunburn. We do advise not icing after that little ice pack that we give you melts, because additional icing can sometimes irritate you and actually make some of the downtime a little worse.
So downtime is minimal. We call this social downtime. Patients feel fine. You're very able to go about, your appointments, your work. Most patients do carve a couple of days out of their social calendar, typically 3 to 4 days. As Garrett mentioned, that initial kind of blotchy, wealthy look does dissipate quickly, but patients do notice an increase of redness in that treatment area and some degree of swelling. Swelling can significantly vary. Some patients are lucky they don't get much, and some patients, like the photo here, significant swelling is normal, will go away, will not cause any secondary problems, but just something to be aware of. Your first session, it's always nice to have a week of just nothing big on your social calendar, and then you'll have a better idea of how you do react. Bruising also is possible. We are working on those little blood vessels. Bruising does go away. You can put makeup on right away, so you can try to cover and conceal.
So post-care, a lot of these recommendations are geared towards the patients that are treating a full face, similar to the slide that Corynn just went over, where you saw Brisson, our office manager, gets fairly puffy for several days. There are a few things you can do to help mitigate the risk of puffiness. Number one is to avoid really salty meals the day of your treatment and for the following 3 to 4 days. You can also take just regular over-the-counter oral antihistamines like Zyrtec, Claritin in the morning. If you tolerate the drowsy Benadryl at night, that can also be an option. Sleeping with your head elevated, if possible, is also helpful. Just generally for everyone, we like to avoid exercise for the first 3 to 4 days, particularly the first 48 hours. Light walking, light stuff is totally fine, but anything that's going to really get your heart rate up, make you sweaty, make you flushed, get your blood pressure high. In theory, some of those really small vessels that we just treated, we're kind of fighting against that. We've collapsed them. And when you get your blood pressure high, when your heart rate gets really high, in theory, it could reverse the treatment a little bit. So avoiding intense cardio for the first couple of days at least can be helpful for making results as great as they can be. Gentle skincare usually for the first 3 to 4 days. And again, we will, during your consultation, look over your products and let you know what to stop and what's okay to continue. But generally, it's going to be gentle cleanser, gentle moisturizers, and sunscreen. And then, as always, with most of our procedures here, we do want you to avoid intense sun exposure for the first few days.
We've got a couple before and after photos to go over. The one on the right is a cherry angioma on the eyelid. With eyelids, we can safely treat. Some patients do complain of just overall redness, little blood vessels on the lids. So in cases like this, we do place an ocular shield, like a little metal contact, which sounds involved, but it's very, very easy. But you can see a great result with that angioma.
And angiomas typically resolve in 1 to 2 sessions when they're this size. When they get larger, they can take several more treatments, but little ones are usually pretty easy, usually 1 to 2 sessions. Here we've got some good vessels you can see on the cheeks here. Vbeam's really good at collapsing these. I usually warn patients when they do have these larger vessels where you can literally see the individual vessels on the face. Those patients are at a little higher risk for bruising. Sometimes those vessels also look a lot darker for the first week, possibly even up to 10 days after treatment, before your body then metabolizes that little vessel that has been collapsed. And I think most of these are after a series of Vbeam. This patient did a series.
Similar here, just a lot of visible blood vessels, kind of that background reddish tones. Yeah, same here. Some of these cases are very severe cases of rosacea. Rosacea is one that trajectory does tend to worsen. So again, it's something that's great, to catch early, treat early. Untreated rosacea can even progress where that skin is actually thickening, it's changing. We see this commonly with gentlemen in the nose, that rhinophyma. So severe case of rosacea, but you can still see a really great result and improvement noted.
This is a little bit more mild, just background flushing. We also use this laser to treat flushing. So patients that complain of their cheeks or nose or chin getting really, really red with exercise, emotional triggers, certain foods or drinks. Because we are collapsing those little vessels that are sitting there in a dense network close to the surface of the skin, when you do get your heart rate up, when you do get embarrassed, when you do drink red wine, those little networks of vessels are not as dense. Therefore, when they expand due to those triggers, the flushing is not as apparent. So it does help with the general facial flushing as well.
This is our Vectra camera. So this is a really neat imaging that we can do in office. Allows us to also pick apart what's sun damage, what's facial volume loss. But in this photo, we can see that hypervascularity, those increased networks of blood vessels under the surface of the skin. And then with treatment, we can see that we have worked to eliminate the large veins, reduce that network, which then correlates to that reduced visible coloration.
So here's one of the birthmarks. This is a port wine stain. And as Corynn mentioned earlier, these patients do often require many more treatments than, say, rosacea or acne scars, because this pigment is very dense, but very successful with a series of treatments.
Here we have some traumatic scars. Again, this laser is not addressing texture. We do have some great modalities and treatments in the office, but by working on the coloration, simply alone, we can see great improvement, makes the scars much less apparent.
Another scar here, we treat a lot of Mohs surgery scars. So Mohs surgery is commonly used procedure to treat basal cell and squamous cell carcinomas. Those little incisions often do develop this very red, sometimes visible vessels around where the procedure has been done, and the Vbeam is really helpful for, again, making that scar look less apparent. We will often combine the Vbeam with other modalities like Fraxel or microneedling. Those modalities help with the texture, and the Vbeam combats the redness. So usually there's a combination of treatments involved to give us the best result.
And then here we have that poikiloderma, so that typical banding pattern across the sides and the front of the neck. A little bit more stubborn to treat. Often patients, and remember Garrett mentioned, you will see sometimes a little bit more downtime. Sometimes you'll see a bit more bruising post-treatment, but a really nice improvement in that coloration.
So now we're just going to take some questions from you guys. Where cost is a very common question. So with Vbeam, it is priced by surface area, by how many pulses of energy we're delivering. Just to give you a general ballpark, if we're treating a face in somebody with rosacea, and we're kind of including the cheeks and nose and chin, usually we're somewhere between $400 and $500 per treatment. Obviously, that could change if we're treating just a small scar or a large birthmark, but just to give you a ballpark, that's usually about the cost of 90% of our patients. Other question, yes, it is safe to treat during pregnancy. As Corynn mentioned, some of the cherry angiomas very commonly appear during pregnancy and hormone changes. So we have and do treat pregnant women successfully and safely.
Another treatment, acne, patients that are on Accutane, that's usually a medication where patients have to be off that medication for a set amount of time before treatment. But the Vbeam is safe to treat, so we can go ahead and work on those scars as soon as possible.
Another good question. So how soon can you treat scars after the injury or surgery? It is case by case. Dr. Cox typically recommends sooner rather than later, and sometimes this will differ from the advice given by your surgeon even. But Dr. Cox is general advice is to treat as soon as the incision is closed and healed. So when the stitches are out and there is no longer an open wound, we can treat pretty quickly. Anything to add to that?
Yeah, no, I agree. I think typically patients are starting kind of 4 to 6 weeks from surgery.
Mm-hmm.
And I agree, we've seen really great success when patients do start soon their treatment.
Any more questions outside of cost? And if there's any individual concerns, we will certainly address that at your consultation. All of the participants today, if you call and mention that you were on our webinar, you will receive a complimentary one-on-one consultation with one of us, and we can certainly go into more depth about your case specifically. We'll do photos, we'll chat through everything.
Another good question about summer safe. A lot of lasers, we do need to be exceptionally careful 1 month before and after. The Vbeam is one that we do want you to be mindful of the sun, wear sunscreen. You cannot be, sunburned in the treatment area, but this laser is summer safe and would be fine to get started at this time.
Well, thank you guys so much for coming. We really enjoyed it. And again, we look forward to seeing you all in the office and answering any individual questions that you have. Again, I'm Garrett.
I'm Corynn. Yeah, thank you so much for taking time with us. We'd love to meet with you. This is also a laser that we can do same day as the consult. So if you're ready to get started, we'd love to see you.